Estradiol cream is a hormone medication used by women to alleviate vaginal symptoms of menopause, such as dryness, burning, and itching. These symptoms are caused by a decrease in estrogen production in the body. When specifically targeting vaginal symptoms of menopause, it is recommended to use products applied directly inside the vagina, like this medication, as a first-line treatment. Estrogens that are taken by mouth, absorbed through the skin, or injected may pose greater risks of side effects due to increased estrogen absorption. It is important to use this medication as directed by your doctor and to discuss the appropriate dosage and timing for your individual needs. When using estradiol cream, it's important to follow the instructions provided by your doctor. You'll need to fill the applicator with the medication and insert it high into the vagina, then press the plunger to release the medication. After each use, be sure to clean the applicator with warm, soapy water and rinse it well. The dosage of this medication will vary based on your medical condition and how you respond to the treatment. It's important to use this medication regularly in order to get the most benefit from it. Make sure to follow your dosing schedule carefully and avoid increasing your dose or using the medication more often or for a longer period of time than directed. If your condition does not improve or if it worsens, be sure to inform your doctor. Some common side effects of estradiol cream may include nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to speak with your doctor or pharmacist. Remember, this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to contact your doctor right away if you experience any serious side effects such as chest pain, sudden/severe headache, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so if you notice anything unusual, it's best to consult with your healthcare provider. Always seek medical help if you notice any signs of a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. If you experience any side effects, be sure to contact your doctor for medical advice. Estrogens, whether used alone or with another hormone, progestin, have the potential to cause serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Using estrogens can increase the risk of cancer of the uterus, endometrial cancer. Taking a progestin as directed by your doctor can help lower this risk. If you experience any unusual vaginal bleeding, be sure to contact your doctor immediately. In postmenopausal women, using estrogens, with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used with a progestin, estrogens can also increase the risk of heart disease, such as heart attacks. The likelihood of serious side effects may depend on the dose of estrogen and how long it is used. This medication should be taken at the lowest effective dose and for the shortest amount of time. It's important to discuss the use of this medication with your doctor and have regular checkups to determine if you still need to use this medication. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. Before using this medication, make sure to talk to your doctor or pharmacist about any allergies you may have or if you have any other medical conditions. This is important because the cream may contain ingredients that could cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor, especially if you have a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, or other health issues. Additionally, if you smoke, it's important to let your doctor know because using estrogen products while smoking can increase the risk of certain health issues. If you are planning to have surgery or will be immobile for a long period of time, it's important to discuss this with your doctor, as it may affect how you use the medication. It's also important to be aware of the potential side effects of the medication, such as the possibility of developing dark areas on the skin when exposed to sunlight, as well as potential vision problems for those who are nearsighted or wear contact lenses. If you are using this medication as a form of birth control, it's important to be aware that some products containing estrogen may weaken rubber products like condoms and diaphragms, so it's important to talk to your pharmacist or doctor about alternative birth control methods. Lastly, it's important to note that this medication should not be used during pregnancy and may also affect breast milk production, so it's important to consult with your doctor if you are pregnant or breastfeeding. It's important to be aware of potential drug interactions when using estradiol cream. Certain medications, including aromatase inhibitors, fezolinetant, fulvestrant, aspamifene, and others, may interact with estradiol cream and affect its effectiveness. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, it's important to note that estradiol cream may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. As always, it's important to follow your doctor's guidance and not change the dosage of any medicines without their approval. If someone accidentally swallows this medicine, it can be harmful. If the person has serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the United States, you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. It's important to seek medical help immediately if any of these symptoms occur. It's important to remember not to share this medication with others. While using this medication, it is essential to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam/mammogram, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. Don't forget to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Making lifestyle changes such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can help control or prevent these diseases. Additionally, keeping your mind active with mental exercises, such as reading and solving crossword puzzles, can help prevent dementia. It's important to talk to your doctor about lifestyle changes that might benefit you. If you forget to use a dose of estradiol cream, use it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and use the next one at your regular time. Do not use a double dose to make up for the missed one. It's important to store estradiol cream at room temperature and keep it out of reach of children and pets. Make sure not to dispose of it by flushing it down the toilet or pouring it into a drain, unless specifically instructed to do so. When the cream is expired or no longer needed, it should be properly discarded. If you have any questions about how to dispose of the cream, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.